So you got your Master's of Public Health in Epidemiology at St. Louis University. But before we get there and the thought process there, were there any undergrad takeaways you wanted to share?
I have so many takeaways, but we don't have the time for that. So I guess I would say, like, if you're in the space, like if whoever's listening is in the space of like coursework, or you're still kind of going through that, but this applies everywhere essentially. But I would branch out like outside of like those public health classes. I think that's something that I wish I would have been more kind of open to, or just like willing to try at least, because I feel like a lot of, while public health has been so helpful in thinking about health in a more complex way, I do think, like, as somebody who has taken courses outside of public health, it's also helped shape the way I think about showing up in the work too. So that's something that I would just encourage like folks to just be open to not get trapped in like the labels of what classes are and the nitty gritty, but more so just like, oh, being open to like thinking about how people are having different conversations, but are very applicable, very relational to like how like I'm currently showing up in the conversation. So yeah.
There's so much to gain from just additional learning outside of public health, and you can bring that to public health. So I agree with that. And I think it's important to expand ourselves into things that aren't necessarily related to public health to reap the benefits of that as well. Because anyway, I won't get into that. Anyway, let's get into your Masters of Public Health. So you're sharing that the research really informed you and like opened your eyes to like this kind of research could happen, this type of research. And from there, I guess you thought more about a master's program. You decided to pursue a Master's of Public Health in Epidemiology. Walk us through that thought process.
Yeah. So I think doing the public health degree at Lindenwood helps me at least know like what public health might be. I still didn't know at the time, but it gave me enough like knowledge to be like, okay, this is what I could expect like going into the field. But I just don't think like I had the capacity to like dive into the things that I wanted to at the undergraduate level. And I thought like the master's program would supplement those things I wasn't able to do. And serendipitously, like doing the research with in my last year of the undergrad program also like gave me like this opportunity to like figure out like what that might look like. Like even though I had like such a good experience in my first role, like I really wanted to just kind of like dive into it, and just see like how research has been done, how other public health people do research in a sense. So kind of like really like a lay of the land. And I particularly did a lot of like spatial epi work because, not another backstory, but it's related to the plot. And my really good friend, she got like a degree in GIS, so Geographic Information Systems. And whenever we would hang out, we always talk about like what we're doing, what we're learning. And we would also we would be doing different things, but we would have like a lot of overlaps regarding like things that are location related. And she convinced me to take a GIS class in my last semester of undergrad, and I loved it immediately. And I like wouldn't shut up about it. And it was sort of like that learning of what that is and how public health people have been doing that for a while made me be like, oh wow, like you can marry disciplines together. Like there's a concept called interdisciplinary public health work. So yeah, the gates were opened, and those were the kind of like the thoughts that I was thinking about going into like some of the research that I wanted to do. So that's what kind of like led me to like the MPH in general, not for just like the professional training, but I think like also like what I wanted to experience like as like someone who's still starting off in research. Those were sort of like my two like justifications of like why I did the MPH.
And while you were doing your MPH, you had a few different positions. I'll list a couple of them out and then you can talk about them. And I think going in line with that GIS trend, you were a GIS analyst at Lincoln County Health Department, a Taylor Geospatial Institute research assistant. And then for St. Louis University, you were a grad research assistant, teaching assistant, and implementation science research assistant. So walk us through those positions.
Yeah. I don't know how I occupied all those positions at mostly the same time, but I think, I think the GIS position at the county fell into me because like this was like right peak of COVID, like the summer of 2020, and someone that I knew, like, that worked at the department, told me about the position and told me to apply because of my interest. And even though I had like literally only a semester's worth of like GIS experience, like I applied, ended up getting it. It was a really good way of like to just figuring out like how am I applying this in practice outside of the coursework, but also like it gave me like a good idea of like how to navigate a pandemic in the health department. So it was just like a lot of like different experiences that opened my eyes as like I'm thinking about like what I want to do after grad school. The research assistant positions like really came in because I knew that like mentorship was so valuable. And at the time I thought I was mature enough to know that like not everybody's going to give me the same thing. Like I'm going to need mentorship in different ways of doing the work. So that's sort of like how I stepped into like different labs and had different feet in like different projects. And that gave me like a feasible sense of like how what type of work I wanted to do after. How does even like running a lab kind of function too? I think it gave me that like insight as well. And just kind of like noticing and taking my own ethnographic notes, like I was like, oh wow, like this is actually kind of fun, like to ask research questions with people who are also interested in asking questions, doing methods that I was still new to, but was really kind of drawn to because they weren't like how other people have been applying research related to like space and health. And it really taught me what it meant to like do interdisciplinary work, kind of drawing from like other fields and how they're doing it, other researchers and how they're doing it. So it was really like a good way of figuring out, at least to the best of my abilities, to like what it means to do public health research. Like I think that's just going to look so different for everybody, but I think because I did all of those things, it really helped me be better familiar of like what that means. One way of doing public health research is being a professor, and when those thoughts came to my mind, I was like, okay, like being a professor is research, but it's also the mentorship and the teaching component. So that's sort of like why I like was intentional about like becoming a teaching assistant, to like learn what it means to also exist in that space of like academia in itself. And I think all of those just resonated with me in different ways, and I kind of took it upon myself to consider PhD programs, and we can get into that too eventually.